welcome back. My name is Eric. We are going to be stripping the Erector Spinae group. We're going to be throwing in some myofascial components and how we strip it. Okay. So the first thing we want to do is apply a little bit of cream. We don't want as much as we would for Swedish because we want the friction. So that's going to be painting. Whenever I throw little dots on there, that's just painting. So I already threw a little bit of cream on there. First thing I'm going to do is do a really quick light fanning in here. Okay, so fingers forward. Go down with this outer hand. It's going to swipe in, windshield wipe in as I get down the lumbar spine. My inner hand is going to keep going, and that is also going to windshield wipe in. So they both windshield wipe in right in there, and then they're both going past the posterior iliac crest, hooking onto the glute. And when I get onto the glute, I'm giving it a nice little compression in there, so it is pushing the pelvis away, which gives it a nice little lumbar stretch in there that's helping to relax and release the lower back, which is going to be the thoracolumbar aponeurosis right in there. Okay. I'm not pushing on the posterior iliac crest. I don't want it to be bone to bone. Soft tissue to the bone is okay, but I don't want to get too compressive on that posterior iliac crest. That's going to be painful. Okay. So for stripping, what I'm going to do is I'm going to use my outer hand. I'm going to sneak this in here. What I like about this technique, I find it's a little bit more uncommon, but what I like about it is it's going to be a nice first strip. It's going to be very broad. If you notice here, my arm is crossing the vertebral column. Now you might think that the ulna is going to be grading on the spinaeus process the whole way down. It's actually not. What's in contact with the vertebral column is going to be the meat of the forearm. The reason I like using this is if my elbow starts getting close to the vertebral column, I'll be able to sense that with the meat of the forearm right here. As opposed to coming here the opposite way, what I don't like about this, and this is a personal preference, is once you're grading the spinaeus process, it's too late. There's not really much of a warning system because there's nothing between your ulna and the vertebral column right there. That's why I like going this way. It just gives me a little bit more sense of where everything's at. Okay. So I come in here, and the space I'm using on here to strip, I'm using this last 3 fingers. Okay, so this is my 3-finger rule. I'm using this area right in here. And if anything, when we think of the Erector Spinae group, we have the base, which is the inside, closer to the vertebral column, the peak, and then the outer base. If anything, I want to be at the peak or slightly medial to the peak. Okay, and that's where I'm going to be stripping, so that way I'm pushing the Erector Spinae group out and away. The other thing I like about this angle is as I'm going inferiorly down the spine, the erector is going to come and meet my forearm, and this angle is naturally going to start feeding the Erector Spinae group out and away from the spine, helping to further decompress the muscle group as we start going. As I start getting to the inferior angle of the scapula, which is right here, I'm going to find a lot of muscles that are beginning, ending. There's a lot of muscle junction in there. A lot of times what we feel is, I call them road bumps in there, where it kind of twangs the body. In order to not twang the body, because I don't like doing that, I find it very disturbing to the nervous system, is I will start to supinate the forearm as I lighten up with my pressure. And then once I'm over that junction, past that inferior angle of the scapula, I'm going to come back, pronate, continue going down. I'm going to bring my other forearm and just give me a base and a pullback. That's going to be a little bit of that myofascial aspect in here. And continue going down the lower back, being careful to sink my body down as I get to the lower back, so I'm running out of skeletal support. I'm going to come up onto the sacrum. Once I'm on the sacrum, I'm already past the posterior iliac crest. I can come back onto the glutes right in there, take a forearm right here, and torque the glutes back. So this is starting to open this up again, further opening up and decompressing that thoracolumbar aponeurosis. Okay, this other strip is going to be more focused. I'm going to start on the opposite side of the vertebral column, just using skin contact, no pressure. Slide it over until my elbow slides into the sacroiliac dimple. This starts to orient the skin in this process. I'm going to gently start to anchor down into my elbow. You can give it a little bit of a back compression into that dimple if you'd like, and then we can start going forward. With this, I'm going to use a little bit more of the elbow as I drag up the vertebral column. Now right in here in this thoracic region is where you're usually going to find more of the tension or possibly a knot. Okay, so as we move up, if we find a knot, let's say we find a knot right in here, I can make a nice little base right in here, bring this up to support the elbow. I call this a cobra because you have your little cobra hood right here. And then we can stop, compress into the spot of tension that we find. The higher up the cobra comes, the more pressure we're going to be able to apply. If we want to bring it down for less pressure, bring it down. When we're done, we can go back to the ulna and continue our strip up the back. We want to stop pressure about 2 to 3 inches before we get to the superior angle of the scapula. So from right here, then I'm just going to transition off with little pressure off the back. And that is going to be stripping the erector spinae group. Make sure you take your time, feel the muscle, let your arm sink into the soft tissue. Don't force the strip.